Hello again. We are the 9th of April 2020. It's 4:15 GMT. We are in Luxembourg, in my home. You have the view behind me to prove that I am locked down here. And we will now cover in this Covideo Ii the prevention that functional medicine can offer to patients against this COVID-19. I have 5 main topics to cover. The first one is about nutrients. Second one is about polyphenols, which have a very interesting role here, because there are several powerful polyphenols displaying antiviral properties, really effective, very fond of that, especially quercetin, that I will explain later on. Number 3 is the anti-inflammatory action we can get from fish oils or oily fish, or both, based on EPA, eicosapentaenoic acid, the most powerful anti-inflammatory compound in the human body. No fear about this type of anti-inflammatory activity, very different from what you get through anti-inflammatory drugs. Would it be ibuprofen or steroids, which seem more and more clearly dangerous for COVID patients. Not very good feedback at all from those approaches, so avoid them. By the way, I should also underline that as long as your fever doesn't go beyond 39, perhaps even slightly more, start to move at 39.5. That is just not an acceptable fever. If you have up to 39 or 39 and a bit, don't try to get this fever down. Your fever is your best protection, is the best way to kill the virus. So fighting that with paracetamol, acetaminophen, as they say in the US, is just nonsense, okay? So just go through it. Let the fever do its antiviral job, and don't use either ibuprofen or paracetamol. Paracetamol, by the way, is extremely liver toxic. It's really something I dislike. Most of my patients know that. Honestly, as a painkiller, I much prefer curcumin, which is totally safe. And don't get this fever down except if it becomes severe, but then you really need to call for help from a doctor if your fever is so high, okay? Number 4 will be about intestinal ecosystem, and number 5 will be about sleep. Okay, let's start with the nutrients, and very importantly, vitamin C, which is, I think, the major player here, which is why I recommend magnesium ascorbate rather than ascorbic acid, because that would be too acidic if you need large quantities. Take a small amount of vitamin C as a prevention, a couple of grams. If you wish, you can push it up, but don't go beyond bowel tolerance, okay? So bowel tolerance is when you don't express bloating, gurgling, gas, and even loose stools or diarrhea if you really push it too far. So don't go that far. If that starts to show up, reduce your vitamin C intake. However, if you get infected, large amounts of vitamin C powder, I think you need a powder at that stage because you can't take so many capsules. You may need 20, 30, 50 grams, up to 80 grams of vitamin C per day to fight the symptoms. You take a teaspoon, it helps the symptoms. If not, you take a second teaspoon, and so on. You take as much as you need to decrease the symptoms. They will decrease. There is a level of vitamin C that will make the symptoms improve. When the symptoms relapse, more vitamin C. You adapt to the symptoms. There's no way to tell you how much vitamin C you will need. When you get worse, you will need more. If you start getting better, you will start seeing you need less. If you're okay, stop taking vitamin C, otherwise you will get diarrhea. If you take a lot of vitamin C to fight symptoms, there's zero diarrhea as long as the symptoms are present or come back. So very important, the vitamin C. Vitamin D, extremely important as well, fundamental. It's a major player. I saw a couple of hours ago an Irish study, recommendation to take vitamin D. Of course, I would suggest 5,000 units in this end of winter, early spring. 5,000 units per day for 1 month cannot hurt. Now, patients tend to have, of course, some program established according to their blood levels, etc. They could stick to those levels. Patients who don't know how much to take, it is not unsafe to take 5,000 units just for 1 month, okay? And try to go through the present shock. Vitamin K, K2, standard dosage, 180 micrograms, I would say. K2, that's perfectly safe. You could take that combined with vitamin D, excellent immune managing duo. Vitamin A, I would also recommend 5,000 international units. Big player, vitamin A, to protect the mucosal system. Vitamin E, also interesting. I don't put it as much as a priority as vitamin A. You could take some vitamin E. Then, very importantly, N-acetylcysteine to boost glutathione stores. Glutathione is a major antioxidant, big player. N-acetylcysteine is, I think, a very good way to sustain glutathione. 600 milligram, 900 milligram, certainly more if you start getting symptoms and mucus coming out of your mucosal system. You could go up to 1,200, 1,800 milligram of N-acetylcysteine while you have those symptoms, okay? Zinc is a big thing because zinc is known as a good antiviral, is very much appreciated by Americans to fight the common cold. So zinc, 30 to 50 milligrams. Selenium, a couple of Brazil nuts per day, or 150 micrograms of selenium. Selenium would be wise, certainly during 1 month to boost your immune protection. All that is very safe, but of course don't go for too long. My approach has always been you test, you identify what is missing, you optimize all those levels, you retest to make sure that is the case, and you adapt the treatment accordingly. But of course, that's an ideal situation. If you don't have that type of program, I've given you some principles. Polyphenols now, very important, the polyphenols, because quercetin is a major player, powerful antiviral, very impressive, effective against coronaviruses. Chinese study earlier this year, very good studies in Ebola, Zika virus, Ebola virus, H1N1 flu virus. Quercetin performs. It's a very impressive antiviral with a specific activity on the lungs. I think you really should take 500 milligrams of quercetin as a prevention and build up to 1,000, 1,500, 2,000 milligrams, little bit depending on body weight, if you are infected, if you have symptoms. More quercetin in that case. Don't forget the foods that bring a lot of quercetin: red onions, shallots, capers, and lovage. Lovage is this amazing forgotten vegetable that was very common in the UK, in the middle of the 20th century, and it has largely disappeared, and that's pitiful. Another powerful polyphenol is apigenin. Apigenin is something I would also be happy to supplement, perhaps 500 milligrams of apigenin. Interesting, effective against coronaviruses, generally speaking. No study for COVID-19, though. If you want it through diet, celery, celeriac, parsley, there's a lot in parsley, and chamomile. So chamomile herbal teas would be really interesting, and more about chamomile when I will speak about sleep. Rosemary, interesting, perhaps to sprinkle on all your cooked dishes or however. Lots of rosemary. And EGCG from green tea. Green tea is a very good beverage in this prevention strategy. Of course, rather in the morning, because we don't want anything exciting in the afternoon, to preserve good sleep. Next topic is fish oil, oily fish. Super important. EPA is going to be the good way to fight inflammation without any side effects, any downsides, because that's a foundation activity in each of your cells to avoid excessive inflammation, but it does not stop inflammation as would steroids. The outcome of patients receiving steroids and who suffer from COVID-19, typically in ICUs, is catastrophic. There's a Chinese study showing 90%, 90, lethality. Well, not something to really consider. Then next topic is about intestinal ecosystem. Well, that's a huge field, cannot develop completely. I remind you the big principles: a good diet, avoid the foods you should not be eating, eat reasonably, no fast sugars, just a little bit for dessert. And then things you can also do regarding the timing: intermittent fasting, hugely recommended as a prevention. I'm not really keen to recommend that if you show symptoms. If you show symptoms, you're hungry, you eat, you don't delay too long, because that could reduce your immune system capacity. But as a prevention, some level, some moderate intermittent fasting is certainly a good idea. To supplement probiotics, prebiotics, synbiotics, which is association of both, curcumin, very good for the gut, and certainly berberine. The ones among you who know me, they know I'm fond of berberine. Berberine is a big player, a huge ally to improve the gut, has some antiviral activity as well. And to finish with, sleep. Well, you know sleep is going to be important. You will struggle perhaps with sleep with all what is going on. So I remind you, melatonin, theanine, which is a big help for fighting anxiety, zero side effect. You can take it in the day as well. Back to the sleep, you also have GABA, glycine, which is an interesting amino acid, and then the calming herbs, chamomile, there we go again, valerian, hops, passion flower, lemon balm, all great calming plants. And to finish with, of course, you would need to mention stress, but it's difficult not to stress in this period of time. Do your best. I like mindfulness, works for me. I just completely struggle to meditate, but I prefer mindfulness. I think everyone has his technique. Tai Chi would be also something hugely recommended. Sport, but of course if you're locked down, there are some limitations, but sport, as long as it's moderate. Don't go into high intensity sport. That's not a good idea. That can be bad for your immune system. Okay? Well, I think these are some reasonable recommendations, and I hope that you can make good use of them, and I wish you to stay in good health. Thank you very much. Bye-bye.